Good afternoon, Chairman, Co-Chairman, and colleagues. I am Phanuwat Boonsun. My advisor is Ajahn Vishan Kanchanathwan. I would like to present my study titled Clinical and Radiological Outcomes of Medial Open-Wedge High Tibial Osteotomy, a comparative study between conventional and simultaneous tibial tubercle elevation. The prevalence of osteoarthritis of knee in Thailand is around 11 to 40%, and medial compartment osteoarthritis of knee in Thailand, its frequency occurs with patellofemoral osteoarthritis, but patellofemoral osteoarthritis is relative contraindication for high tibial osteotomy because high tibial osteotomy it increases the patellofemoral contact pressure, which worsens the patellofemoral osteoarthritis. Many literature try to figure out the technique to solve the problem from high tibial osteotomy with patellofemoral osteoarthritis patients, but no standard technique exists. This table accumulates the study of high tibial osteotomy with many techniques and their results in order to decrease patellofemoral contact pressure. And both significant and not significant difference both found in the study. According to Dr. Jawa, proposed medial open-wedge high tibial osteotomy with modified Marquet procedure that have two osteotomy. First, tibial tuberosity and sterilization osteotomy, 10 cm from the tibial tuberosity, then fixed with screw. Second is the medial open-wedge high tibial osteotomy. But the limitation for this technique are two separate osteotomy, which extended to diaphysis is the wrong osteotomy, and needs bone graft to fill the bony defect. This is the rationale for this study proposing a medial open-wedge high tibial osteotomy simultaneous with tibial tubercle elevation. First, perform the osteotomy at the medial side, 4 cm from the joint line direct to the fibula tip, and simultaneously make a step cut at the tibial tuberosity and left the posterolateral as a hinge. Then make a gap and maintain with spacer and fix with tomofix pad. Conventional high tibial osteotomy correct only coronal plane, as this technique opens a gap in the medial side, resulting in posterior tibial slope and patellar height is changed. For the right picture, show the open-wedge high tibial osteotomy with simultaneous tibial tubercle elevation method that can correct both coronal and sagittal plane in the meaning of both mediolateral and posterolateral correction. The advantages are minimal change of posterior tibial slope and patellofemoral contact pressure, but the drawback is the chance of the complete cortical breakage of the posterolateral side. Our hypothesis is that medial open-wedge high tibial osteotomy with simultaneous tibial tubercle elevation can improve clinical and radiological outcome in patients with medial compartment osteoarthritis of knee accompanied with patellofemoral osteoarthritis. The primary objective in this study is to evaluate the clinical outcomes of medial open-wedge high tibial osteotomy when done with conventional versus simultaneous tibial tubercle elevation, and radiological outcomes are secondary objective for this study. This study is retrospective cohort study. The inclusion criteria is patients with medial compartment osteoarthritis of knee accompanied with patellofemoral osteoarthritis who underwent medial open-wedge high tibial osteotomy, conventional and simultaneous tibial tubercle elevation method, adults in hospital between 2005 to 2015, age between 45 to 65 years old, and status community ambulatory without grade 8, and exclude the patient with varus osteoarthritis of knee from the ligament insufficiency. According to the previous study, the sample size was calculated as 46. 33 is group. For data correction, composed of gender, age, occupation, comorbidity, IKDC score Thai version, questionnaire, visual analog scale, lateral pain film of 30-degree flexion knee, and autoangiogram. Clinical outcomes we evaluated by International Knee Documentation Committee Subjective Knee Form Thai version, and visual analog scale. Patellar height and posterior tibial slope for the radiological outcomes. For results at 2 years, There were 46 patients divided to 23 patients in each group, no difference in demographic data. For clinical outcomes, a significant improvement in AKDC scores and visual analog scale was observed in both groups. And for the radiological outcomes, radiologic studies for both groups show a significant increase in patellar height and posterior tibial slope. And when comparing for the two groups, there was a significant improvement in clinical outcomes as well as radiological outcomes in tibial tubercle elevation methods. For the discussion, medial compartment osteoarthritis of knee is a frequency accompanied with patellofemoral osteoarthritis. According to Dr. Chewa in 2013, proposed the medial compartment, medial open-wedge high tibial osteotomy and modified market procedure is effective treatment for medial and patellofemoral compartmental osteoarthritis, but limitation for long osteotomy and is for the bone graft. Our technique is a simultaneous tibial tubercle elevation method. It's a simultaneous osteotomy at the medial and the tibial tuberosity, both coronal and sagittal pain correction, and advantage in minimal change of posterior tibial slope and patellar height. For limitation, this is a retrospective study. And for conclusion, high tibial osteotomy is simultaneous tibial tubercle elevation is effective procedure for the treatment of medial compartment osteoarthritis of knee with patellofemoral osteoarthritis. It's good clinical outcome, minimal change in patellar height and posterior tibial slope, comparing with conventional technique, and decrease the patellofemoral contact pressure post-operatively. Thank you.